Hi everybody, tonight we are going to be debunking AAC myths. And this is one of my favorite topics because there is a lot of misinformation out there in our field regarding AAC. And we do have some lovely research that we will go through that helps us debunk and clarify a lot of this information. So we'll start with myth number one. Which I've personally heard very, very often in my own practice. But that is that AAC is going to stifle an individual's ability to speak. And there is a decade worth of research that debunks this myth. So Millar, Light, and Schlosser in 2006 reviewed previously published studies that, among other criteria, presented data on speech production before, during, and after AAC intervention. Now, the review revealed that these participants demonstrated increases in speech production, that was 89% of them. 11% experienced no change in speech production. And the biggest piece here, it's highlighted that 0%, none of the candidates experienced decreased speech production. So you might be asking yourself why, and that is because we use multiple forms of communication every day. So we talk, we point, we use facial expressions, body language, and AAC is no different. It can coexist with other forms of communication as well. And more research shows that AAC has a positive effect on speech because, number one, it increases and improves an individual's participation in conversations. It allows people to produce longer messages. This is what I've actually found. The second point here is that it provides a model for the individual as well as an association between a word and the symbol. So think that icon, that image. AAC is also a tool that can cue a person. So that self-cueing and recall for older adults in conversation is very common. It's huge. And AAC reduces physical demands and the pressure to speak. So it's just really interesting how these devices not only do not stifle an individual's ability to speak, but in fact can help improve natural speech. So definitely a good talking piece when we're having family conferences and trying to inform our patients and their families on the benefits and kind of clarifying the muddy waters here with AAC. Now, myth number two states that AAC should be the last resort for nonverbal or minimally verbal individuals. So the biggest question here that I've heard clinicians ask themselves oftentimes is, does natural speech need to be completely absent before introducing AAC? And the answer is no. Okay, so natural speech does not need to be absent. You might hear me say this many, many times. You might have already heard me say it many times already up until this point, but AAC is just a communication tool. So certainly we have clients that perhaps are going to progress, perhaps are not severe in their communication impairment and still do have some natural speech, and the communication device just serves as that tool to help them when they need, when there is communication breakdown. But the point I have up here about ALS clients or our clients that have these degenerative progressive diagnoses is they often don't get the evaluation and AAC treatment they need until they no longer have functional communication. So that's either on the part of the patient and the family themselves, just trying to preserve and work on natural speech and not going down the path of AAC until kind of that last moment. But it is so helpful when you even think about neuroplasticity to introduce an AAC system as soon as possible. The earlier the intervention, the better. And kind of the second point we have here ties in is that many people believe they have to exhaust all other options before introducing AAC, so that they do have to work on as much speech and language before they introduce this AAC system. When it comes to high-tech AAC, we often see this statement coming up. There are clinicians and people alike that feel as though they need to start at low tech and that they need to kind of advance themselves to higher tech. We'll actually touch on that a little bit more later in the lecture. Another thought is that perhaps this piece stems from wanting to restore natural speech and language. So we're just kind of waiting up until that last minute, just hoping that natural speech will come back. So we are not introducing AAC initially. And lastly, we have a little piece of research here that states AAC can be an essential tool for treatment, as well as a mechanism to bridge the individual into functional communication. So it is important to consider AAC as part of a treatment rather than just an alternative or a last resort. And that was by Fager in 2007. Now on to myth number 3. This states that an individual needs to have a set of prerequisite skills to qualify or to benefit from AAC. So the issue here with this myth, and when we buy into it, is that access to AAC is not being provided. It's being delayed or it's being limited because we're waiting for an individual to develop prerequisite skills in order for us to introduce the system. I think this oftentimes goes hand in hand or gets kind of confused and muddied up with funding for through insurance companies for a speech generating device, that we feel as though our client needs to have a set of cognitive skills in order to qualify or benefit from AAC. So the big piece and caveat there is that sure, they do need to demonstrate that they can use the device functionally for communication, okay? But that doesn't mean that we have to wait to introduce the device. We can work on cognitive skills, we can work on receptive language as we're using the AAC system. And of course, you certainly can use AAC with assistance. We don't have to have someone that is completely independent and proficient with their system in order for them to be a good candidate. Okay, so myth number 4 states that there is a hierarchy of AAC systems that each individual needs to move through, okay, before gaining access to high-tech systems. So I actually briefly mentioned this when we were talking about myth number 2. They all, seem to kind of go hand in hand, but the answer here is no. There is no hierarchy, and it's not necessary for our users to show competence with low-tech systems before we provide, say, a communication device. And one big talking piece that I found really helpful to get everybody to truly understand this is asking, do we typically ask toddlers to point to pictures before they begin to use their voice to communicate? And the answer is no, that babies communicate with their voices well before they can ever point to a picture. They cry to get our attention. They take their turn in cooing back and forth. So even when they do begin to point to objects and pictures, pointing is often accompanied by vocalizations or word approximations. So these children know the power of communicating using their voices well before they're able to produce clear words, and are developing the ability to communicate using multiple communication methods, pointing, facial expressions, so on and so forth. So you might ask yourself, well, what are the benefits to, going straight to a high-tech system for an individual? And the biggest piece here is customization. There are individuals who need a highly customized system. Either they need it very simple, very relevant to them. They need it changing and evolving on a more consistent basis than we are able to provide low-tech pictures on a board. Another reason is for the speech output. So we often have candidates who really need that speech output to self-cue, or it does help them kind of bridge the gap with their receptive language or cognitive impairment when they hear it out loud as opposed to just seeing a picture and a written word. We also have users that need that speech output to gain their communication partner's attention, or perhaps they want to be able to communicate over the phone or with people in another room. And also motivation. So high-tech systems are able to be, again, customized and suited to a particular individual's interests and hobbies and lifestyle. So like tools in a tool belt, we use the one that is most appropriate for the situation. So there are situations where high-tech AAC is going to be the most appropriate, and then there are others where gesturing is most appropriate. And the little example here is just to think about ourselves. You know, there are sometimes we gesture rather than talk. And let's say that's during a ceremony or a play, you know, we're gesturing to the person next to us like, shh, you know, putting our finger to our mouth to gesture to be quiet, as opposed to just saying out loud, hey, be quiet. So skilled AAC users share that they choose their communication method based on the situation. Okay, so just like us, they might choose one communication method over another. So they might use an alphabet board with familiar partners that are able to quickly guess after they pointed just a few letters, or they might use a communication device with less familiar partners. So low-tech tools are considered a vital backup. So I think I've said this before, and I'll certainly reiterate it. Low-tech and high-tech should always be considered, both of them, not just one in isolation. Of course, we know because devices are not charged, they need to go in for repair, or we're by the pool or in a tub where we can't bring in a high-tech system. So that is that piece on myth number 4. Now, myth number 5 states that individuals with severe disabilities cannot have the adequate cognitive skills to use AAC. And I actually have some personal experience with this myth because I worked in a facility with individuals on my caseload who did have severe medical conditions and disabilities that affected not only their cognition, but of course their motor skills as well. And really here, this myth implies that there are individuals that are too impaired or too low to use AAC, or at least, you know, to use more than just a very simple form. And these statements are actually assumptions, and they do result in AAC, you know, systems communications being delayed, limited, not provided at all. So that might sound familiar from an earlier myth. And what happens when an individual has limited or no access to functional communication for a period of time? Well, I know what I personally saw in my practice was increased frustration with communication. We used to see increased behaviors, you know, from grown adults, but there had to be behavior specialists in place because of all of the frustrations that people were encountering with not being able to communicate. We also see depression and or withdrawal from social situations when you just don't have the proper method and means to communicate. And lastly, we see resistance to AAC when it is finally presented. So a little bit more on this myth. So the belief that individuals have to have a certain set of cognitive skills before being able to use AAC likely comes from studying the way children begin learning language and speaking. So, for example, children typically demonstrate the following cognitive skills before they begin to speak, right? They usually show some sort of cause and effect, understanding that one event is a consequence of another, or a means end, planning steps to reach a goal. Often children show object permanence, so objects continue to exist when they're out of sight, so on and so forth, right? So we know that children do that, but that actually does not carry over to all of our AAC users when it comes to learning and using AAC. So Kangas and Lloyd in 1988 reviewed a variety of early language studies, and they found that cognitive development and developing speech and language are related. However, the relationship is not causal, so it's not cause and effect. And at times, language skills actually appeared before expected cognitive skills had been developed. So these statements alone cast considerable doubt on our choice to withhold or delay AAC, kind of waiting for cognitive skills to appear first. And one thing that I do often kind of bring up in my conversations is that communication experience actually provides those rich learning opportunities, and it can be the vehicle for actually expanding cognitive skills. So very, very important to keep in mind. We always want to err on the side of caution. We want to provide more rather than provide less. Okay, now myth number 6 is that AAC is going to completely remove the user's communication difficulties. Well, why do we believe this myth in the first place? And I feel like every once in a while we will hear or read a story of how AAC seriously turn someone's life around. And some of these stories are based on research results, because research does confirm that AAC enhances an individual's ability to communicate effectively. We know that it encourages use of natural speech, and it facilitates development of language and literacy skills. We know that it promotes and establishes and maintains social relationships, but there are limitations here. And I think that there are often issues and challenges because, number one, of initial acceptance and ongoing use of AAC by individuals who have complex needs or those who support them. Also, building skills of the individual and communication partners in AAC take time, okay? And that is certainly a factor that influences kind of this idea that we're going to completely remove all communication difficulties. And lastly, there are limitations related to the tool itself. And some of that we've already touched upon, right? There are limitations in how many symbols we can anticipate that someone will use, right? We try our best to select the appropriate vocabulary, but life is ever changing, and sometimes, especially in those kind of unexpected, unpredicted, novel moments where we need novel utterances, we don't always have the symbol or the ability to serve our users. So again, the realistic results of AAC is that the system can take advantage of and even leverage the strengths of the individuals, okay? But areas of challenges or deficit, well, not if, so pause. Areas of challenge or deficit can actually be positively affected by AAC, but not eliminated. So that's the big piece there. The skills and attitudes of communication partners can affect the use of AAC. So that could be positively or negatively. And us as clinicians, we can actually influence that. But that's something to keep in mind. You know, why hasn't it completely removed a user's communication difficulties? Well, we can always look to see, does the communication partner need further training? Because they might be able to negatively influence use. So competent communication using AAC requires linguistic, operational, social, and strategic skills, which are all acquired at varying rates. So that is something that we discussed earlier in this semester. And so we might have an individual who has exceptional linguistic skills, but not yet have mastered the operational or strategic skills to actually find all the symbols, and the strategic skills to repair communication breakdown. Now, AAC, we know, should be part of a multimodal communication system. This we've said a few times at this point. Lastly, AAC can help individuals with more severe communication disabilities participate more fully in their desired social roles. So these are the realistic kind of key points of AAC, but we know that there are a lot of challenges. Okay, myth number 7, if an individual has some or even a little bit of speech, AAC is not needed. But we know that AAC should be used for anybody who experiences a gap between what they want to say and what they can say. Now, when it comes to funding a speech generating device through insurance, there is criteria as far as the communication impairment is concerned. In order for a device to be deemed a medical necessity, the communication impairment needs to at least be moderate severe. Okay, but an AAC system can certainly be used for an individual who has a mild or even just a moderate communication impairment. So it doesn't have to just be for an individual that does not have any speech. Okay, so just some questions and reflection here that I want you guys to think about for a moment, and then I'd like you to share it on the discussion board. The first one is, how do you feel when someone speaks for you, but they don't exactly say everything that you were thinking? They do it incorrectly. So someone speaks up for you, but they're not quite giving all the information that you'd like. Or how do you feel when someone assumes they know what you're thinking or feeling and they don't, right? They're wrong. Also, I want you guys to think about what it would be like to be able to produce only a few words or sentences that people could understand. And lastly, I want you guys to contemplate and share, what would it be like if you were able to communicate by repeating the last words that are said by others, or only by producing lines from movies or television shows? So basically what you hear. All right, so I'm gonna keep those up here on the screen for just a moment. You guys should also have it in the discussion board itself. If you wanna jot down some thoughts right now and then revisit it after this lecture, that's probably ideal, because we have just a little bit more actually on this myth. So the cost of relying on familiarity and context is that it assumes the communication partner always knows what someone else is going to say. So that's why I asked you to kind of think about, what about if you needed to rely on your communication partner to speak for you? It also assumes that an individual will always say the same thing in a given situation, or that you will always be there to interpret accurately. And it's just not always a helpful assumption in any relationship. Lastly, it does not allow for or encourage growth or independence in an individual's communication skills and interests. And lastly, it limits the individual's ability to communicate outside of the circle of those who are familiar and knowledgeable that can speak up for them, right? Because they're not going to be, unfamiliar listeners are not going to be able to kind of fill in those gaps and speak for them. So the person with a severe communication impairment cannot effectively establish or deepen relationships with others or demonstrate new knowledge or thoughts, right? So we want to use AAC as part of an overall communication system and kind of avoid these issues that pop up. So again, here are the questions or reflections. I'll put them up again with this myth. Okay, and we will move on. Okay, our last myth, myth number 8. AAC must be used independently to be an appropriate recommendation for a person. So this view ignores the fact that none of us communicate independently or perfectly, right? I know that when I'm out with my friends, or even sometimes when I'm giving this lecture, it's often helpful to, you know, when you pause and you can't think of the word, does someone often fill in the blank for you? Oh, what's that word I'm thinking of? And someone says, oh, this? So that happens with even normal speakers. So it's just important to keep that in mind. Communication does not happen in a vacuum. It's a two-way street. We rely on others to collaborate with us to establish meaning and to provide that assistance and support when we need, right? Even doing this online lecture as I talk to you guys, I can't see you in person. So that makes it more difficult, I am sure, for you guys as well. Co-construction is really important. So you actually see, for individuals with aphasia, it's supported by research, where there's one strategy for minimizing communication breakdown and for people with aphasia and their communication partners is to establish shared communication spaces for messages. And the key feature is that the interactants, right, the participants, assume joint responsibility for formulating, expressing, and confirming the intents. So there's some research behind that, Hux et al. In 2010. And then we also see Kagan in 1998 had a protocol for supported communication for people with aphasia, and that was consistent with message co-construction. So again, even the most fluent speaker needs to be helped to recall a word occasionally. We need to ask questions to clarify, you know, a statement or whatnot. So that is myth number 8. And you know, I'm realizing this was a bit out of order. So my apologies here. I'm going to put this back on the board. This should have been the last myth and not myth number 7. So it could have been more of a natural transition for you guys. So my apologies. But again, I'm really looking forward to reading your insightful and thoughtful comments, just kind of on how you might feel, you know, if when someone speaks for you incorrectly, or when someone assumes that they know what you're thinking and feeling. All right, so we will speak soon. Please let me know if you have any questions or concerns. I'm looking forward to hearing from you guys. Thanks so much. Bye.